This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Hello once again, and welcome into Health Watch here on Talk Radio 1210 WPHT. My name is Paul Perillo. Excuse me there, I got a frog in my throat. But as we get, you got anything for me for a frog in my throat, Dr.
You
Molly?
bet, you bet, Paul, of course.
I
God bless you.
woke up this morning and my sound a little rough in the throat, but I don't know if it's allergies or the change of season. I mean, this what are they saying? This is the last weekend of summer. So today, Sunday, is the last weekend day of summer. And before you know it, dare I even say that the holidays are right around the corner, Dr. Molly?
You bet. You bet. It's a great time, though, Paul. First of all, I want to say how grateful I am that you're hosting the show today along with myself and our wonderful good friend, John DeMasi. He's getting better by the day. He's getting better by the day, folks, because, you know, he has a big following, Paul. He's like you. You guys are like the VIPs in Philadelphia. Come on. You know it. So, yes.
Well, we'll take that, but we're not going to settle any of the city's problems, that's for sure.
That's for
we'll
sure.
Take all the accolades, but we're not getting involved in politics.
Amen.
That's right.
Amen.
So we are back again for another week here on Health Watch with Dr. Molly Fantasia, the PhD doctor, and John DeMasi, who's our usual sidekick, is in the house with us, and he'll be chiming in from time to time throughout the hour. But and of course, we'll open up the phone lines for you to join in on the discussion here on Talk Radio 1210 WPHT. But after last week's show, I learned a lot, and I know a lot of people that either emailed me or texted me and said, "Hey, great show, learned so much," and that's so important because that's why we do these shows, to get the information out there. And I always think a good place, Dr. Molly, to begin is an overview of what Innovative Medical Associates is all about and what sets them apart from other doctors or services that are out there.
Well, you know, the first thing, Paul, is that, you know, we're a co-op of all healthcare providers. By that I mean we're cooperating all out of my facility, which is a licensed primary care facility in Marlton, New Jersey. And we're a little different. We're also a lot alike compared to other primary care facilities. So if you come to us and you have a viral situation and you need some drugs, we're going to be able to prescribe them. The docs are going to be able to prescribe them for you. But it's our philosophy that really actually separates us from the pack. We believe in using the least amount of the pharmaceutical to effectuate the medical change that the doctors want to see happen. And we do that by using the hydration therapy as the cornerstone of our primary care practice. And it really does help when we look at some of the natural substances in order to really reduce the side effects of these pharmaceuticals. Because, Paul, let me tell you, sometimes the side effects are worse than the illness.
True.
That's why we came this way. So that's really the big difference in what we do. A little side note I'd like to say. Yesterday, of course, I was walking around one of the casinos in AC, and they have a spa. And I look in the window, and they have like 3 reclining chairs, and they have a counter out with some nutraceuticals like vitamin C, and I'm looking at the labels. Now, I'm behind the glass. I'm in the mall where this is happening, and I'm looking at these, and they're all manufactured, and they got about 5 things there, and they put a sign up that says, hangover, tired, fatigued. They go through this litany, and I'm looking at this, and I'm thinking, wow, I'm so far removed from that. It is unbelievable. I mean, we have a full medication room that we would not have our protocols and or our particular nutraceuticals just laying on a table where they sell beauty products in addition. So I thought it was pretty interesting because it goes to the fact that people are becoming more and more aware of hydration therapy. And that's the other reason we are so different. We are not a spa. We are truly a medical facility, Paul.
That's so important. And the bigger question is, Dr. Molly, did you hit while you were in the casino?
No, I actually was just I was doing my walk, and
Okay.
it was. I was just doing my walk, and it like blew me away. I have to say the truth when I saw this, because I thought, wow. I'll tell you one thing, that wouldn't fly in our. My nurse Barbara would put an end to that kind of thing, where your nutraceuticals are up on your counter, wide open for anything to attach to them or whatever. We're very, very astute in infection control. So that's just a side note, folks.
Sure. And it's so important that people really take the deep dive into this,
Right,
because
right.
You know, like in the case, anybody could have been walking past that spa, saw the supplements on the counter, may have gone in and purchased them there, and they're not even sure what they're purchasing.
That's it. And can you imagine? You have a choice of 4 particular protocols that were fairly standard protocols that you might get in the ER if you were really in detoxing from a night of inebriation. You know what I mean? But
Sure.
This is certainly not what we do at Innovative Medical Associates, and that's a clarity I would like out there. It really makes a difference, Paul.
I often get the question, and it's a legitimate question. People will say, I heard you on the radio. Why do you do that show? Or why are you so in tune with what the guest is talking about on the show? And I basically respond that it's so important to get the correct information into our listeners' hands, because there's a lot of misinformation that is out there. And sometimes people, in a fleeting sense of just listening, only hear what they want to hear, or they're really not paying that close attention that they need to. And that's why I do it. That's why I step up to the plate and say, sure, I'll help you out. Yeah, let's get the information out about that, because information is power. There is no doubt about it. And you're going to really find a lot of information on the website for Innovative Medical Associates. The website is innovativemedicalassociates.com. They're located in Marlton, New Jersey. And I think you would agree, Dr. Molly, that education, information is power, especially when it comes to our health.
Absolutely, absolutely. And I will tell you, the majority of our particular clients' patients understand that. They've done the research, and they may have been frustrated by going a traditional route. And again, I want to stress to all the listeners out there, I don't necessarily tell people they have to go an all alternative route. I say, let's bring in the best of both worlds, see what we need to do to correct your challenges, keep you healthy, keep your quality of life. That's what we do at Innovative Medical Associates. We want to help you maintain a high quality of life, because it's not good to just languish around and be fatigued and not really, or brain fog and all the rest of this. If you're not having a quality of life, and whatever that is for each individual, that's the important thing, Paul.
You hit the nail on the head. Quality of life. And at the end of the day, I think that's what everybody really strives for. You know, no one likes to go around with a hangnail, or they don't want to go around with a headache. They don't want to go around with a very serious diagnosis, because it impacts your quality of life, whether you're retired, whether you're working, whether you're a new mom, whether you're a school teacher, whatever. It's really all about that quality of life. And that's what you're going to get with Dr. Molly and her fantastic staff at Innovative Medical Associates. It's all about the quality of life. And what a better place to show up and get that initial free consultation, Dr. Molly.
That's great. That's it. We're ready to
rock. We're going to take a break here, and we're going to take some phone calls as well. Let me do this. I'll open up the phone lines, first of all, at 855-839-1210. That's 855-839-1210. You could also use your cell phone. All you have to do is push pound 1210. I also want to get the information out about the website, as well as that phone number where you could call the office right now. There is someone standing by to take your calls and get in for that initial free consultation. 856-489-0505. 856-489-0505. The website, and let me tell you, one of the best innovative integrated websites that I've seen in a long time, because all the information is right there. There are no smoke and mirrors that you got to go behind before you find out the information. It's all there. It's at innovativemedicalassociates.com. And you can find out more information about Dr. Molly, more information about all the different protocols that her office offer to you. It's all about the quality of life. So innovativemedicalassociates.com. And when we come back, we'll continue with Dr. Molly here on Health Watch on Talk Radio 1210 WPHT. Welcome back to Health Watch here on Talk Radio 1210 WPHT. Paul Perillo along with Dr. Molly Fantasia and John DeMasi. We are live and local. That means you call in right now. We are going to get to your phone calls, and whatever the question, Dr. Molly would love to hear from you. It's 855-839-1210, 855-839-1210. Use your cell phone. All you have to do is push pound 1210. And get this, we have that replay of our show. This show is going to be replayed later this afternoon at 4 o'clock right here on Talk Radio 1210 WPHT. So if there's anything you missed in our first segment, you could catch up at 4 o'clock this afternoon. Or if you want to recommend a friend, tune in at 4 and listen to the program. That's why we're here. So the replay, make sure you tune in for that at 4 o'clock this afternoon. I think we have a caller on the line. I don't want to keep anybody holding all that long. So, Dr. Molly, let's welcome in Tim from the Tacony section of our listing area. Hey there, Tim. Welcome to the program.
How you doing
Tim.
today?
Hey, Tim. How you doing today, my friend?
Great.
Good. Tim, tell us a little bit about your story. Yeah.
It's been about a year. In November, it'll be a year. I had COVID pneumonia. And I was in ICU for 11 days. But before I had it, when I first got the symptoms, I came to you.
I remember.
Yeah, and that probably saved my life. Your protocols and the stuff that you gave me got me through. Actually, you're the one that sent me to the hospital.
I am the one that sent you to the hospital. You're right. I remember it like it was yesterday, Tim. And, the good news was, thank God you did not need to be intubated. And I think you're right that the protocol that I put you on for those few days helped you at least maintain some of the integrity of the lung cells that were able to helpfully regenerate and get you going again. And I thank God that you went to the hospital when I told you to go, and to the hospital I told you to go to. So
right from your office, I went to the hospital.
That's right. And I thank God that you're alive and well. And I got to tell you, Tim, compared to a lot of other people who've had COVID, and you do suffer from some of the post-COVID syndrome, but honestly, I got the report from, I think, one of your specialists, and it looked pretty good. I mean, Dr. Testa was thrilled. We just were thrilled about it because it really looks like you're recovering. It is taking a little toll on you because you're a strong guy, though. You're a strong guy. And I really appreciate the call, and I just want you to be as well as possible. By the way, Tim's a new granddad, so we should all thank God.
Congratulations.
Yeah, he's got a brand new baby. So, we want you around for a long time, Tim. Thank you.
Yes. Thank you,
All right,
Dr.
Tim.
Molly.
Thank you so much for calling in.
Thank you.
That frees up a line. It sounds like he was on a cell phone. All you have to do is push pound 1210, 855-839-1210. Dr. Molly, I hear a lot about killer cells.
Right.
So can you explain that a little
Sure,
bit to us?
Sure. Well, killer cells are really they're really the white cells that we have. Killer cells are, inherent to us, and they help protect the body from viruses. We were just talking to Tim, viruses and also some other bacteria and other things, right? And we found that as we age, researchers had found there's several good scientific articles about this. Our natural killer cells become less effective. So hydration is one of the ways by which we may be able to increase killer cell count. And along with, believe it or not, our earlier show that was on, probiotics. Probiotics are another reason that can help killer cells retain their integrity. But these cells are very unique, and we see them a lot. We see them a lot in autoimmune conditions. The killer cells are really important in autoimmune to help hold down some of the inflammation. And again, I'm going to talk about something called Goldilocks, because sometimes you can produce an overabundance amount of the killer cells in the joints that are swollen. So the way we approach that is we use some particular nutraceuticals to keep these killer cells in the right amount. So we don't want them to be overriding your body, but we want them to do the job. So this is very important. Immune health is extremely important in just about any chronic condition that you have. You need to tune up these cells. And we also look at doing this with the MSC cells that people are talking about in terms of regenerative medicine. So there are many ways to help keep the level of the killer cells present in the bloodstream, keep the number up to really help effectuate the change for a patient, and to improve their quality of life. So killer cells are extremely important, folks.
Yes. I have to mention here that Dr. Molly has been at the forefront of all of this information, and just hearing her explain the whole area of killer cells and probiotics and nutraceuticals. I mean, she's been out in front of this for a number of years. It seems, though, Dr. Molly, a lot of people, perhaps competitors, other businesses out there, have finally wised up to what you have been saying, and they're starting to jump on the bandwagon. I mean, there's nothing worse than somebody jumping on the bandwagon, but it's a lot of credit to you because you've been out there for years now talking about this. 26
years in October. Wow. All right, 26 years.
You were started what, when you were
17,
18?
That's right. In fact, I'm going to make John laugh. He may jump in on this. I think he was a babe too at that point.
I was about. I was 17.
And you too, Paul. I remember doing a show with you and John when we were all kids. So guess what? Time goes by, but truly, I've been in this for 26 years, which is why I believe the new spa-like places that have opened up and jumped in, and et cetera, et cetera. I got to say that, truthfully, my staff, my physicians, my registered nurses, my nursing people, I believe they are in this much more than just looking at somebody and saying, oh, well, you need some skin cream, which, by the way, we have. But the point is, they're really looking overall to improve a person's quality of life. And it's been our mission statement since the whole 26 years. And I do believe that we do it the best. We have a ton of protocols that we've developed, and I've been lucky enough to work with the greatest physicians out there. Actually, right now, Dr. Pat is one of the physicians I'm working with, Dr. Mark. And Dr. Pat is an anesthesiologist, board certified. So in terms of using regenerative medicine, whether it's PRP or whatever, we're really doing a lot, honestly, Paul, in terms of helping people feel better and get better and hopefully improve their quality of life and improve their relationships with people, because when you feel good, right? Actually, my lovely Linda says something that's really true. It's better to look good than feel good, although she said, nah, it's really better to feel good. So we believe in both. Thank you, Paul. Yeah. So.
We're coming up on another break here, and again, I just want to encourage people, whether you're listening now or during the replay at 4 p.m., here on Talk Radio 1210 WPHT, you owe it to yourself. You absolutely owe it to yourself to call and set up that free initial consultation. That number to call is 856, jot this number down, 856-489-0505, 856-489-0505, and you could call right now. There's someone in the office. Take your phone call, get your information, and get you in to see Dr. Molly and her fantastic staff at Innovative Medical Associates. And I really mean that. Over the past few weeks, back and forth with Dr. Molly, every time I've called the office, they have been the most welcoming, inviting, friendliest people on the phone. Look, no one wants to call a phone number and have to go through 14 phone prompts before you get a real live person. Am I right or what?
Oh
you
my
right.
God, it's incredible. I tell you, it's
After
just
a while,
incredible.
you want to hang up. It's like,
Yeah.
okay, forget about it. I don't need to get this rectified now. And then my wife will turn around and say, oh, we'll just call first thing tomorrow morning. It's the same thing.
Doesn't work.
It really doesn't work.
Doesn't work.
So when you call Innovative Medical Associates, someone's going to be there to answer the phone and direct your call to the proper person. So you owe it to yourself. 856-489-0505. Dr. Molly has talked about quality of life. At the end of the day, that's what it's all about. You owe it to yourself. Call Innovative Medical Associates. You could also check them out online at innovativemedicalassociates.com. They're located in Marlton, New Jersey. And Dr. Molly, the PhD, that's the PhD doctor, will be with us right for another half hour. So we got a few more segments here right up until the top of the hour. Plenty of time for you to call in, 855-839-1210. Use that cell phone. All you have to do is push pound 1210. That'll put you in touch with us here on Health Watch on Talk Radio 1210 WPHT. Welcome back to Health Watch here on Talk Radio 1210 WPHT. Paul Perillo along with Dr. Molly Fantasia and John DeMasi. We're at the halfway point of our program. We have plenty of time for you to call in. If you have a question for Dr. Molly, our phone lines are open, 855-839-1210. You can also use your cell phone. Verizon Wireless customers, AT&T, all you have to do is push pound 1210. We're talking about the great work that Dr. Molly and her staff do at Innovative Medical Associates, located in Marlton, New Jersey. You can check them out online at innovativemedicalassociates.com. And, of course, I remind you about the replay that'll be at 4 o'clock this afternoon here on Talk Radio 1210 WPHT. Now, I don't remember much from my philosophy class at LaSalle some 40-some years ago. It was still a college then when I was there, Dr. Molly. That's
Me too, Paul.
Right, John's a LaSalle grad. But there was my philosophy class, first period of the morning, 8 o'clock in the morning, and we talked about, there's not much that I remember, but I remember Socrates saying that all problems really begin in the stomach.
Right. He said all illness begins in the gut. And interestingly enough, now 1,000 years later or so, maybe it's several thousand years later, I'm not a history buff major, but bottom line is today in honest to goodness traditional medicine, I mean Western medicine, the kind that you would get in the ER if you walked in, we actually know that has a big part of our life. The gut holds a big part of our life. And I alluded to probiotics in the last segment, and they are extremely important for our natural killer cells. They have many therapeutic benefits, and of course probiotics are a part of our hydration therapy protocols. And one of the things I can tell you is that even though the mechanism of this probiotic isn't always understood completely, we know that the reaction on the killer cells are that they actually help them do their job on a micro level. So probiotics are just what they are. They're good bacteria in your gut. Also, prebiotics, and as was spoken about in your earlier show, the show before mine, this is very important, and it's fiber. It's extracted either from rice or some other type of fiber. And what that does is it feeds the good bacteria. And again, I go back to the old story about Goldilocks. We need the appropriate amount of good bacteria in our gut to help us fight the bad stuff. And one of the interesting scientific journals I saw was that people who suffered from COVID and who were exposed, those who were exposed and didn't get COVID, and those who were exposed and got the COVID, had various levels of the good bacteria. So there's something to be said for that. In other words, the good bacteria help protect their own killer cells to help kill those viruses. So that's really an important lesson to be learned in this. And another thing, we use a lot of antioxidants so vitamin C in particular, in our post-COVID protocol to help actually the body regenerate their own probiotic, meaning the good bacteria. But most of the time, we all need to supplement with a probiotic. So that's a great quote, Paul. Thank you.
Yeah, I guess I want to stress the importance of this, because this is something that people say, well, I'm outside working, and I'm in the daylight, I'm in sunshine all day, and so I'm getting enough vitamin C. I don't need to supplement.
Yeah.
Is that a fair statement, or is that an ignorant statement?
I think it's an interesting statement, because here's the thing. I think, yes, you're going to read a lot of the naysayers tell you that when you take extra vitamin C, what happens is you just have expensive urine. Well, that may be true in some regard, but when you give an appropriate extract of vitamin C, for example, in our clinic, we don't just use a manufactured ascorbic acid. Vitamin C is vitamin C is vitamin C. I agree with that. I'm a scientist. I agree with that. But the extract, I believe the body has an innate ability to know when the extract is extracted from food source. For example, we have a cancer protocol, a supportive protocol. We use a lot of tapioca extracted vitamin C. And then we're able to reach a therapeutic level, and that's what you want to have. You want to maintain the therapeutic level. Yes, you may excrete some of the extra, but it's the therapeutic level working on the cellular level that actually does the job. The other thing people have said, which I find very interesting, is, I'm out in the sun all day, I'm getting great vitamin D. Do you know that 80% of the people who come into our clinic when we run serum vitamin D levels, that's a traditional test, generally have very low levels? It's unbelievable. Wow. So, no, you're not getting enough vitamin D, and that's another supplement that is necessary, and we use a great deal of it. And we use it in olive oil, sesame seed oil. I mean, it's unbelievable. And if you don't have enough vitamin D, you definitely are running the risk of having your own immune system be impaired. So, yeah, short answer, no, but truthful answer is that people can use supplementation. We're not getting anything near what we should out of our food sources right now.
We can talk here a little bit about what you can expect when you show up at the office door for Dr. Molly Fantasia, because I think that's important, because we discussed this a little bit last week. We have a few minutes here before we go to the break. 855-839-1210. We'd love to hear from you. But, there's always that nervousness. I know. Look, even when I go for my, routine checkup, not that I've gotten better over the years, but my wife will tell you I'm the biggest baby on the face of the earth when it comes to going to the doctor. I don't know if it was something from when I was a kid and it just sticks with me, getting like a booster shot or a needle or the flu shot. I mean, I have to set myself up. I kiddingly will tell the doctor or the tech in CVS or Walgreens or whatever that I'm needle phobic. All I have to do is see the needle, and I go into a state of panic because I just don't like needles. But that's not the case when you show up at Dr. Molly's office. No. The people there are friendly. Everybody's there. It's such a caring environment, and that's why I really love and appreciate everything that Dr. Molly does at her office.
Paul, it's not just a caring environment. I would say we were a very well-equipped environment. So when people come in, and I think John can attest to that, we actually do. The gals are excellent. We have vein finders. The bottom line is this. When you come in to see me for the free consultation, it's at that moment that I'm able to ascertain what it is you may need. That's prior to doing any additional blood work. If you come in with your records from previous visits to other physicians and you have a list of challenges that are impeding your quality of life, at that point I'm able to say, listen, I think we can help you. And by the way, Paul, I have said to people, this is not the place for you. I'm not about just, saying, okay, yeah, sit in the chair. No, sir. sir. We don't do that. I really want, when you make a commitment to come to our facility, we make a commitment back to you to do the best we can to get you where you want to be with your quality of life. And sometimes we can't do it for all people, and then we try to help you get to a place that may be able to help you. Because I have a list of specialists that'll knock anybody's socks off and have good relationships with traditional physicians, because my physicians were trained traditionally, and I am a trained scientist, so there's no doubt we can help you in one way or another, and certainly advocate for you. But it all starts with the free consultation. If you come in, you bring your material, and we go from there, Paul.
Yep, and again, to get that free consultation, 856-489-0505. And I like the word that Dr. Molly just used, commitment, because in this day and age, we want instant gratification, Dr. Molly. We want that I can go to the corner store, buy whatever it is that I need to buy, and I'm going to come back and I'm going to feel great. That's not necessarily the case when it comes to our health, but you got to be committed to it. You got to really dig down. You got to dig those heels into the ground and say, okay, I'm committed to this. I'm committed to hydration therapy. I'm committed to going to innovative medical associates for whether my regimen is going to be 1 week, 2 weeks, 6 weeks, but you got to be committed to it. Ultimately, you got to remember what the prize is at the end of the race, but you got to have that sense of commitment. I think you would agree.
Absolutely. There's definitely a commitment involved here from our perspective and also from the patient's perspective.
Absolutely. All right. We're up against a break, and we have one more segment straight ahead. You can get in if you want to give us a call, 855-839-1210, 855-839-1210. Use your cell phone. All you have to do is push pound 1210. InnovativeMedicalAssociates.com. That's where you can find more information about what Dr. Molly is talking about here on the program. You can also call and get that free consultation, set up that appointment, 856-489-0505. It's Health Watch here on Talk Radio 1210 WPHT. Welcome back to Health Watch here on Talk Radio 1210 WPHT. Paul Perillo, along with Dr. Molly Fantasia, the PhD doctor. That's the PhD doctor, and John DeMasi. And we got some phone calls lined up. That's good. So we're going to try to squeeze in as many as we can. We're going to say hello first to Rose in Northeast Philadelphia. Hey there, Rose. Welcome to the program.
Rose. Hi, Rose.
Good morning, and thank you, Dr. Molly. And my question is, I want to talk about a severe coronary artery disease that I was diagnosed with at the age of 49.
Oh,
and
my
I
God.
had a double bypass of 49 emergency, and then I had 2 stents put in last year.
Now, how old are you now, Rose? How old are you now?
I'm 72.
God bless you. God bless you.
Thank you. Thank you. So I have a few questions.
Sure.
We couldn't put any more stents in because the arteries are all too clogged.
Mm-hmm.
So what else can I do? I try and do everything I can. And I read an article last night about fasting, like fasting with no food for like days on end.
Well,
and
now
I can easily do 3 days with no food.
All right. Well, God bless you. There is a thing about intermittent fasting, but I'll tell you what you really should do. Come in and see me. Chelation therapy. Have you read about that? Chelation therapy?
I have.
You need, and we do it well. I'll tell you the truth. 26 years ago, we started with chelation therapy, and we have improved this methodology very, very carefully improved it, and we're getting tremendous results. I just had a patient who went in for their cardiac scoring, the calcium scoring. As you know, the calcium buildup is the hard plaquing. This patient went in. They had zero calcifications. They started with us about a year ago, or a year and a half, I guess, a little more than a year. They had mucho calcifications, and the chelation is keeping their stents patent and open. Chelation, and also we have another protocol that uses another amino acid for hard plaquing and plaquing going up into the brain, this kind of thing. In fact, I just used it on our friend John. And this particular protocol helps the plaquing also. It's a very specific protocol, and we use a specific amino acid that was developed in Germany. So there are ways to do this. Now, the thing about chelation, just so you know, Rose, unfortunately, it doesn't work like holy water. It's not one treatment and you can walk on water. No, it takes a series of treatments because it's about chelating or clawing out the junk that contributes to this calcification. And for lots of us, in particular in my clinic, it's genetic in a way. We just make this calcification. So yes, there is something you can do, and you should. You're young, 72. You got a lot of life and a lot of good quality ahead. I really think you should look into chelation. Does that help?
Yeah, no, that does help. And can I just ask you, like, how long do these grafts last? Hopefully they last until I die.
Well, you're talking about the stenting that was put in. You're saying, right?
No, not the
stent. And the bypass surgeries, right?
The bypass.
Yeah,
Yes.
well, that is a hard question to answer. You know, there's a lot to think about with that. You have to look systemically. You know, has your blood pressure been under control? Is everything good? You know, who actually did the surgery, my dear? There are so many things to look at, but I will tell you this. Chelation could improve you 12% in terms of global circulation. That's a big number when you look at body surface. You should call my office. Come in. I'd love to talk to you more about this, darling. Thank you, Rose. God bless.
Thank you. The number to call is 856-489-0505. A great call from Northeast Philadelphia. I'm going to squeeze in another call here real quickly. Let's go to Pam, who's from Marlton, New Jersey. Hey there, Pam. Welcome to the program.
Good morning, Molly.
Hey, Pam. And John's sitting right here as well.
Hi, John.
So,
Hi.
Hey,
morning.
Pam, your story is one that just resonates with people because, of course, it's a cancer supportive story, and I would love you to tell it if you could in this segment. It's fabulous.
Of course, sure. So I was diagnosed with breast cancer 21 years ago, the first time.
Wow.
I had a double mastectomy back then, 2001, and I was fine for years. 8 years later, I had a recurrence, which is really rare with a double mastectomy. I went to see all the big wigs.
Yes, you did.
In South Jersey, and they wanted me to do, like, everything this time, the chemo, the radiation, all these drugs. And I was very hesitant, and I said to the top oncologist, what can you give me that's non-toxic? And she laughed and said nothing.
That's right.
So I really had a lot of decisions to make. I didn't know what I was going to do. And by the grace of God and my mom up in heaven, my brother found you.
I remember.
We know. Somehow he found you, just really by a chance.
Right.
And came in. He called me. I'll never forget this. He called me, and I was driving, and he told me about you. I pulled over on the side of the road, wrote your phone number down, and called you from a parking lot and made an appointment, was in there the next day, and I've been there for 13 and a half years.
That's right, Pam.
So God bless you.
And you know what? Thank God. The man upstairs, you know we believe this. But you know, Pam, you help us too because you're very strict with your diet. I mean, you're not you're not a nun, but you're strict.
I try.
Right. And that's important. So we try to help where we can. And I will tell you that the thing that I love about our cancer supportive program is that the patients help support each other through it. And I think nobody in the clinic tells somebody, "Oh, well, you're doing chemo. That's wrong."
No, not at all.
No,
Nobody
we want to support.
That was my choice, my personal choice, and it was a hard choice, and it was a scary choice.
Because you also had a young baby then. You know, you had a young kid.
Son,
right,
you know,
wonderful
he was
kid, by the way.
and
Yeah, he's a wonderful boy too. But that's a side note. But the point is, here we are. We don't choose. We do not upset our patients. If you want to do chemo, you want to do radiation, we just will help you support your way through it.
Exactly.
Because a lot of patients don't do well through the chemo. And the oncology.
Yeah, my mom went through it, and I watched her, and it was rough.
Yeah.
Yeah.
So you know, and
I mean, go ahead.
it's rough. It is rough. But one thing I would say, Pam, when you look at the patients in our clinic who are doing the chemo, they tend to do pretty well. As a matter of fact, we have one young lady who said to me, she's not that young, she's in her 70s. She said, Molly, I'm not losing my hair. I said, so she's using the little trick that I told her to use. And she said,
wow.
they said up there, well, I don't know, that doesn't work. Well, she said, look at me, it's working. Which that means something to me.
Of course.
Pam,
well, you're amazing. You know how I feel about you.
Come
I
on.
love you.
Well,
yes, you are.
We love all
you're
our
like
patients.
Family.
Well,
you're not
that's
just
how.
my doctor. You're like family.
Thank you, and we feel that way. God bless you, Pam. Thanks for the call, and we love you, and I'll see you this week. Amen.
Yeah.
God bless.
All right, Pam, thanks so much. And we have, I don't want to get started with the call, and then we have to end it shortly because we're at the end of the line here. But I can't encourage, even as a result of Pam's call, I mean, if there isn't a better opportunity to listen to a call just like Pam's right now and pick up the phone and make that call to Innovative Medical Associates at 856-489-0505. You can call and set up that free appointment right now. You can find out more information online at innovativemedicalassociates.com, located in Marlton, New Jersey. And as we come to the end of the line here, our good friend John has been sitting there, and I know he's got his usual roundup at the end of the show.
Okay.
John, the floor is yours.
On behalf of Dr. Molly and everyone at Innovative Medical Associates, the lovely Linda, our nurses Barbara, Catherine, Lana. Then there's fabulous Fran, delightful Dee, Joanne, at our medical assistant Karen Kathy. Thanks for listening. We'll talk to you next week here on Health Watch.
All right, there you go. Health Watch on Talk Radio 1210. My name's Paul Perillo.
Thank you,
Thanks
John.
so much for listening to this show. We'll be back again next week. Listen to the replay at 4 o'clock this afternoon. And we invite you to call in next week on our program here, Health Watch, on Talk Radio 1210 WPHT.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.